with certified regulated pharmacies, you're not going to have any safety issues. We have not had one safety concern. We have not had one complaint from our employees or retirees or the dependents. The bottom line here is that these are the exact same medications, as you've already indicated, that come from the United States that you can purchase at your local pharmacy. By the way, Governor, I noticed on CNN today as I was coming over from my hotel that Walgreens has a little problem relative to expiration dates. You know, it can happen, but you don't develop public policy based on the bad acts of others. You develop public policy on the benefit and the good for the people that you serve. Now, I've met with the FDA. I've had a meeting with them in Washington last September. If the FDA sat down with me and gave me 20 minutes, I would negotiate a plan with them that would meet with their satisfaction, that would address the safety concerns, and we would have a pilot program up and running, as we already have in Springfield, Massachusetts for the last 8 months. Governor Doyle's correct. We have saved to date over $1.5 million of a budget of over $400 million. And when this program is fully implemented, there are savings of upwards of $9 million. Now, I'd like to take credit for being the wise man that went to Canada, but as you have already indicated, Americans have been going to Canada for many, many years. I did it out of need and necessity. My health care costs for my employees, my retirees, went up 100% in the 8 years that I was mayor of Springfield, Massachusetts. Prescription costs went up from $8.6 million to almost $20 million in the same 8 years. And my provider, Blue Cross Blue Shield, told me, Mr. Mayor, guess what? It's going to go up another 20% this year, this current fiscal year. I said, okay, that's enough. So we looked at the Canadian program, and you know the results now. Very successful, very popular, no co-pays for my employees or retirees, and the bottom line is that it's safe, it's effective, and it's a relief to the taxpayers. You know, we all look to our state governments for financial assistance. In Massachusetts, we call it local aid. We all look to the federal government for financial assistance, whether it's the COP program or HUD or the Community Development Block Grant programs. This is a local aid package for cities and towns across America. So if anything can be learned by the experience in Springfield, Massachusetts, it's been positive. I urge the governors to continue in their quest, and I urge the United States Congress and the President to pass a bill that'll, in a more formal way, legalize reimportation. It's good for the consumer, it's good for states, it's good for cities and towns.
Thank you, Mayor. Thank you for being here.
Thank you, Governor.
We'll continue on with the panel, then we'll come back for questions and answers. The next panel member is Andy Trozak. He's representing the Canadian International Pharmacy Association. He's got
only in the last 4 years where mail-order pharmacies in Canada trained to some
for the questions.
FDA has recently suggested come in the U.S. not safe if they widely prescribed, accounting for